this video, we are talking all about babies cruising at furniture, how to help them learn how to cruise, when they should be cruising, and how long it typically takes a baby to go from cruising to walking independently. Stay tuned. Hi, I'm Dr. Lauren Baker, Pediatric Physical Therapist, and on this channel, we help proactive parents learn how to help their babies move better. Think of me as your pediatric physical therapy bestie, learning tips and tricks to help your babies move with confidence and ease. In today's video, we are going over a couple of ways that you can help your babies learn how to cruise at furniture. So specifically at a small table, as well as how to cruise at the couch. Let's jump into one of parents' most interested questions, which is, what age should my baby be cruising at furniture? And of course, that age is a range, but we like to see babies cruising from the age of 7 months to 12 months. Now, as a pediatric physical therapist, I do prefer that my babies crawl for at least 2 months, even if they are pulling to stand and cruising. I really want to make sure that they have that time to strengthen their hand muscles, strengthen their hip muscles, get that crossbody movement, as well as start to learn how to move their head isolated from their body. This is all really important for pre-academic skills, and crazy to know, it starts when they are babies. And so if you have a little that is pulling to stand at 7 months, a little bit on that early end, and is starting to want to cruise, that is totally fine. But what I would encourage you to do is make sure that they are mastering crawling, which is on extended elbows, hands, and knees. If you do need extra help in the area of crawling, maybe your kiddo skipped crawling, or you're not sure, they're not really showing signs of crawling, but they are showing signs of cruising, make sure you check out the Learning to Crawl playlist, and that will have a bunch of exercises so that you can make sure that they don't skip that important milestone. Now, you might also be asking, hey, my baby is a little bit on the older end. When should I be concerned if they are not showing signs of cruising? And the answer to that question is at around 12 months, if your baby is not showing signs of pulling to stand or cruising, walking side to side while holding on to furniture, then I definitely recommend that you consult with a pediatric physical therapist or pediatric physiotherapist. If you don't know of any in your area, make sure you check the pinned comment, because you can schedule an online parent consultation with me where we can talk all about cruising and whether or not it is a good idea for you to find somebody in person. It is one of my joys to help parents find therapists that are close to them or other resources that can help them help their babies move better. How long does it take babies who are cruising by holding onto furniture to walk independently? And the answer to that question is there's a lot of factors involved. Typically, it's going to be a month to a couple months from when they start to cruise before they're starting to lift one hand up, bring both hands up while they're standing at a stable surface, and then progress to starting to take independent steps, 1 or 2, and then falling to the ground, and then progressing to be able to transition from close surfaces, around corners, and then transition to push walkers, and then transition to independent walking. So there are a lot of little mini milestones before you go from cruising to walking independently. Where I see kiddos get caught up with the transition from cruising to walking independently is if a kiddo is struggling to bend down and pick toys up off of the floor. There are a bunch of videos that I've made on transitioning into sitting or transitioning from standing to sitting. So if that is an area where you know your kiddo might be struggling, make sure that you stick to the end of this video so that you can get the exact video that I recommend next. So we're going to talk about cruising. So when babies walk and hold on. Yeah, you know you want to play. You want to play. When babies walk and hold on, and I'm going to talk about how to shift their weight, how to help them so that they can do it more effectively, and also so that we can build those hip and core muscles. Hi, can you say hi? Say hi, friends. Hi. So the biggest thing you want to look at is you want the babies to be able to hold their weight standing on a couch. So you might have a toy that they're interested in. Ooh. And then as they take steps, you want to hold that C shape, again, my favorite position, around their hips. And then, ooh, this isn't the best toy. This is not the best toy. Let's go get it. Okay, and so I want her to kind of bring that foot out, bring the other foot towards. Yeah, good work. And then we're gonna bring this foot forward. I want the toes mostly pointing forward, but with babies, there's gonna be a varying degree of toe out, and that's okay. You just want it to be a little bit more neutral. So when you have a baby go into pull to stand, hey friend, what's up here? You wanna entice them to come up, and then try to get them in a half kneel position. No thanks. Okay, so I want her to bring that ankle up. No thanks. Oh, it's over here. Okay, okay, hands up. Good job. Step. I'm shifting her weight over to that stance leg. You are a big, strong girl. Hi. So we think that it is much easier to explain, but when you're in practice, it can be much harder. Go, step. And then I'm gonna shift her weight over. We're gonna bring that leg there. It's most effective. Yeah, I see you going on those toes to get it. Okay, and then while they're here, instead of having them kind of collapse to the floor, being behind them so that they can come back down into a sitting position. So we're gonna keep going. So when you're cruising, you want the baby to go, I know, hi. You want the baby to go from one direction of the couch to the other direction of the couch. You can also have them go, hey, what's this guy? Yeah. You can also have them go, yeah, I know, we're tired. Why does Miss Lauren always do videos at the end? Why does she always do that end? You can have them go in a straight line, and you can also have them go in a 90-degree line. Hi. We're gonna go up. You can place them in standing, or you can have them work on going into standing. Good job. Here we go. What's over here? Go get it. Go, go, go. And then we've got that C shape. I want her to weight bear through. She's not wanting to weight bear through this left hand. Okay, we gotta move our body to get to it. Go boop. There we go. Good job. And I want her to kind of weight bear equally. Yeah, hi. Hi. And then again, we're gonna, oh, you got it. You were too good. Right there. Okay, I want her to shift her weight to her left foot. Yeah, this way is harder. I know. So we're gonna shift our weight to the left foot to go to the right foot and then back down. I know, that's hard. That's hard. Okay, so I'm gonna shift her weight to the right so that she can place that left foot down, and then shift her weight to the left so she can move her right foot, left. There you go, good job. You do. More, oh, you got it. Go more. And then I might kind of work on her foot placement. Hi, to keep it a little bit more neutral. Go get it. Where is it? It's right here. Hi, look, do you see our friends? We're so close. Yeah, keep going. I know this is hard for you. And then we're right here, and I'm gonna bring her down. Hi.
I know that one's the most fun. Mom's gonna help. Good work. And then I'm gonna weight shift over to the right. I'm helping her move it to the right, and then she's moving her left foot. Sometimes you have to work on either. Looky, you go. And I'm helping her shift her weight over because I want that hip to be on top of that ankle. Oh, good job. Whew. And honestly, helping babies work is a workout for ourselves. Yeah. Oh, thanks. Oh, thanks. Let's go get over there. Let's go. Okay, so this one I'm gonna weight shift to the right so she can bring her left leg. Oh, she's doing a good job. Good work. There you go. There we go. You are highly motivated. Good job. And then when we're here, I'm gonna be behind her and we're gonna come sit down. Yeah.
And that's a wrap, friends. I am so proud of you for staying to the end of this video because that tells me that you are really invested in making sure that your baby can move well and optimally. A lot of times parents are told that they don't need to worry about things or that, just give them time. And while that is not necessarily bad advice, it's also not necessarily optimal advice. There are so many things that you can do to help your baby move better, but also to give you the opportunity to connect with your baby in a deeper way by playing with them strategically on the floor. And I love being able to bring these different tips and tricks to you guys, especially those who are obsessed with learning as much as they can in order to help their babies move well and be strong. Now, we did talk about one of the most important aspects in that transition to walking independently, from cruising to walking independently, is being able to pick a toy up off the ground, as well as transitioning from standing to sitting. If you know your baby is struggling with that, or you just want to double check and make sure everything is good, make sure you check this video out next, and that will cover that skill. If you have any other questions for me, make sure you check that pinned comment down below so that you can schedule a one-on-one online consultation and we can chat all about the milestone of cruising and how that progresses into walking.